antiseptics, disinfectants, and any other kind of chemical that can be used for sterilization is what we'll discuss in this section. We're going to control microbial growth with various kinds of chemicals. And in fact, we can create words that tell us the type of effect we're going to have with our various chemicals on different kinds of microorganisms by simply assembling a prefix with a suffix. Like bacteria would be our prefix, meaning bacteria, and then cidal, meaning killing. Bactericidal means that whatever chemical we're using is going to kill the bacteria. Bacteriostatic, static means simply slowing down. So bacteriostatic means we're going to slow down the growth of the bacteria, and then oftentimes using a bacteriostatic, we're following along with some other kinds of method or treatment to remove the bacteria from that surface or from that area once we've slowed down the growth. Fungicidal, fungistatic means killing fungi, slowing down or inhibiting the growth of fungi. Virucidal, we're killing viruses. Those are all descriptive terms that tell us how we're affecting the various kinds of microorganisms with our different kinds of chemicals. There are various types of chemical antimicrobials that we could use as either disinfectants and or antiseptics. A disinfectant is a chemical that we would use on a fomite or inanimate object to remove or reduce the number of microorganisms on that surface. An antiseptic is a chemical that will do the same thing, remove or kill any microorganisms on a surface, but we're talking about skin. It has to be safe enough to use on skin. And so if we take a look at these examples, we have isopropyl alcohol, ethyl alcohol. Those are both very good antiseptics and disinfectants. They can be used on both skin and hard surfaces to remove and reduce the population of any microorganisms on those surfaces. The other items, phenol, benzalkonium chloride, hexachlorophene, and ethylene oxide, can all be used with varying success on different kinds of surfaces. Phenol, especially, is the essential standard to which all other disinfectants are compared. It was really the first historically important disinfectant and antiseptic to be used in the mid-1800s. Joseph Lister was, in fact, the historically important British surgeon who introduced the concept and the practice of using a disinfectant during surgery to prevent unwanted infection. Benzalkonium chloride and hexachlorophene have been used to some extent in antiseptics or surface materials to clean skin, but they do have some adverse effects. So sometimes they're not the first choice as an antiseptic, but they also do make good disinfectants. And ethylene oxide is a gas that's used to sterilize instruments. Chemical antimicrobials have a variety of effects on microorganisms. Particularly, we're thinking bacteria and viruses. With bacteria, many antimicrobials are going to disrupt the cell membrane, and by disrupting the cell membrane, it will prevent materials essentially from getting in and out effectively, or maybe weaken the cell membrane so that the cell just simply busts open. We find that some chemical antimicrobials will denature the proteins. By denaturing proteins, particularly enzymes that are needed by the cell for perfect function, we've again stopped the growth or maybe even killed the bacteria by targeting unique specific proteins that the cell needs for growth. By altering the pH, mechanically disrupting the surface of the cell, again, we can control growth, we can inhibit the function of various chemicals, metabolites. Remember, pH can affect protein function, enzyme function, Mechanically disrupting simply means we're tearing it apart. Heavy metals act like poisons. They bind irreversibly, oftentimes, to key enzymes. Some examples of common chemical antimicrobials are soaps. Oftentimes the pH of soaps are alkaline, so that's a shift in pH that would inhibit the normal function of many proteins inside of a cell. And they have surfactants that will dissolve or disrupt cytoplasmic membranes. Alcohols. Alcohols will denature proteins, depending upon the percent concentration. Formaldehyde. Formaldehyde we would think of as a fixative. It permanently alters protein function and nucleic acid function and irreversibly changes those particular biochemicals, and again inhibiting the growth and the continued function of those materials inside of a cell so that the cell dies. Now, in 1867, Joseph Lister used phenol in surgery for the first time. He had observed years before that farmers used carbolic acid, which is another name for phenol, to control anthrax and various kinds of diseases in their farm animals. He saw that the farmers would simply splash the carbolic acid, or we also call it phenol, on the hay and the bedding, on the stalls, on the wounds, just using it as we would today, like an antiseptic and a disinfectant. But it wasn't common practice for surgeons in particular to use any kind of materials like that in a surgical suite to prevent infection. In fact, in 1867, they really weren't certain where infections came from and how to control it. So when Lister saw the farmers using this solution, this liquid, and having great success preventing disease in their farm animals, he thought, well, why not? Converted it to a spray using the little spray atomizer that was available at the time, and sure enough, the first few compound fracture patients that he attempted to both set the bone and repair the wound, because a compound fracture includes not only a broken bone, but a wound because the bone has protruded through the muscle and the skin. At this time in the 19th century, anyone with a compound fracture had a very high rate or likelihood of dying. A compound fracture in the 19th, 18th, or 17th century was almost a death sentence, depending on how dirty the wound was. Of course, they didn't relate the dirtiness of the wound with the likelihood of infection. They really didn't know. So, on 4 compound fracture patients, Joseph Lister attempted to use his new phenol disinfectant to inhibit or prevent whatever might be causing these infections in these wounds, and very successfully the patients who should have died from infection didn't. We've since used phenol as our standard disinfectant for the comparison of any other new disinfectant that might be manufactured or proclaimed to be even better. We think of phenol as the gold standard for comparison, and there is a standardized test using 5% phenol with a specific concentration or cell number of Salmonella typhi, which is a gram-negative rod, and Staphylococcus aureus as the representative gram-positive cocci. When we go through the test procedure, what we will generate is essentially a number, and it's called the phenol coefficient. Once we run our new disinfectant and determine its effectiveness against Staph aureus and Salmonella typhi and compare it to the effectiveness of phenol, we're going to essentially create a ratio or a coefficient of effectiveness. The phenol coefficient tells us if the material is better or not as effective as phenol. Notice that phenol, we actually generate our phenol coefficient of 1. That's the standard to which we're going to compare everything else. A phenol coefficient less than 1 means that particular material is less effective than phenol as a chemical agent to be used as a disinfectant. If the phenol coefficient is larger than 1, then we can easily say that that particular chemical is more effective as a disinfectant than phenol. So take a look at things like chloramine and mercury chloride. Those are very effective disinfectants. They're very effective at killing. Then look at formalin. That almost doesn't make any sense. We know that formalin is a fixative. If you place cells in formalin, they'll be dead in a short period of time. So the phenol coefficient isn't a 100% accurate reflection of how hazardous a chemical can be. It just simply tells us in terms of being a disinfectant how effective a chemical can be. And chloramines and mercury chlorides are very effective. They're also very toxic, so we have to be very careful where we're using them. We look at more likely disinfectants that you might use in your everyday life, things like ethanol, which has a coefficient of 6.3, and tincture of chloride, tincture of iodine. The tincture of iodine has roughly a 6 as a phenol coefficient. So again, it's a little bit better as a disinfectant than phenol, and in fact is safer as an antiseptic because phenol has now been characterized as a mild or weak mutagen. As a mutagen, it can cause mutations in bacteria, which means it has the potential to cause cancer in people. So we don't use phenol anymore as a disinfectant in microbiology labs, though up until about the mid-1980s, before we knew that phenol was a mutagen, we did use 5% phenol routinely in teaching labs. We used to have big jugs of 5% phenol, and the students would fill up their little squirt bottles and clean off the tabletops with 5% phenol and think nothing of it. When the EPA finally published their report that phenol was a potential mutagenic agent, we quickly took phenol out of all of the laboratories, and we now use either bleach or alcohol as our surface disinfectant for routine cleaning in microbiology labs. Sometimes we do use more powerful disinfectants if we're working in research or clinical laboratories, but even there we still might rely on alcohol as a very good and effective disinfectant.
You may also find other alternative disinfectants that are commercially prepared might be used in your work area or any other place of employment. So 10% bleach, 70% alcohol, and any other commercially prepared disinfectant are all good, safe, effective means of controlling the presence of microbes in your work area.
Now there are a variety of ways or test methods that we can use, again, to determine the effectiveness of various kinds of antiseptics and disinfectants. One method is called the disc diffusion test, or the disc diffusion procedure, where you want to use little filter paper discs, saturate those little filter paper discs with a certain amount of the chemical in question, create a lawn of bacteria, a fresh lawn, on the surface of an agar plate. So we would streak the bacteria on the surface of an agar plate for a confluent lawn. In other words, we would cover the entire surface with bacteria. Once we've freshly inoculated with a confluent lawn our agar plate, then we're going to place the little paper discs on the surface of the agar, right with our bacteria, and then put it in the incubator. Incubate 18 to 24 hours, take it out, and determine if there are any zones of inhibition where we see no bacterial growth around those paper discs. If we see no growth of bacteria around the little paper discs, that gives us an idea or an indication that this particular chemical is probably a very effective disinfectant, or antiseptic, depending on the safety of use on skin of that particular chemical. Now, this disc diffusion method is used not only for antiseptics and disinfectants, but we'll see when we get into our discussion on antimicrobials, the same procedure can be used. The only difference being the little paper discs will be saturated with antimicrobials, like antibiotics. We measure the diameter of the zone of inhibition, and based on prior testing, we can often compare the effectiveness of our antiseptics and disinfectants to other prior tested antiseptics and disinfectants with this method of measuring the zone of inhibition. How wide is the circle where we see no growth of bacteria? The tube dilution test is another way of determining the effectiveness of various antiseptics and disinfectants. We have various tubes. In this illustration, we have 10 tubes set up. They're going to have decreasing concentrations of our chemical in question. And then we add the same amount of bacteria to each test tube. The test tube with the most concentrated amount of antimicrobial or antiseptic or disinfectant is on the far right, where we see absolutely no growth of bacteria in that test tube. As we move from right to left, notice that the test tubes become more and more cloudy, so that the test tube on the far left has the least amount of chemical, disinfectant, or antiseptic, and so we have the most growth. By measuring the concentration in the test tube where we last see any visible growth, which according to what I'm looking at on this photo would be test tube going from right to left, would be the third test tube from the right. Would be that test tube where we see no growth. It has less disinfectant or antiseptic than the first test tube, which has the most, and that would be the concentration that we would call the minimum inhibitory concentration, or MIC. That's as low as we could go, diluting our antiseptic or disinfectant, and still get killing effect that gave us no visible growth. Now we can go one step further and actually subculture those first 3 test tubes that show no apparent visible growth. If we subculture them onto an agar plate and find that maybe there were a few cells still alive at the bottom of the test tube, not very likely, but it is possible. But we go one step beyond just the visual observation of no growth, and we actually confirm that there's no growth. We would call that the minimum bactericidal concentration, or MBC. So MBC, we've gone one step further and confirmed absolutely no growth of the bacteria in the test tube with our chemical of question or of interest. Oftentimes, both the tube dilution method and the disc diffusion method are run together or correlated, and we compare the difference in effectiveness with the tube dilution and the disc diffusion test. Notice in this illustration, organism A, for both the disc diffusion test and the tube dilution test, or the MIC, give us similar kinds of results. With the MIC, we can actually calculate how much antimicrobial we could use to treat our particular infection. We'd have to correlate that with the zone of inhibition on the disc diffusion test. And there are charts that do that. Scientists in industry have given those resources to us to give us a really good idea of the best possible choice to treat an infection, or to clean up a surface, or prevent the spread of microorganism. If we look at the organism B, notice that both the tube dilution test and the disc diffusion test agree in terms of the fact that this particular chemical would not be a good choice for organism B.